Welcome everyone to this online panel event about how life sciences can go to market into the US. And we're going to present a strategic roadmap on how this can be done in what we are now calling changing times. My name is Mark Stimpfig and I'm from Foothold America, and we've helped hundreds of UK and EU companies, especially in life sciences, set up and grow their business in the US. Before we start the panel, I'd like actually, at the last minute, we've had a very interesting expert join us, and I'd like, if I may, to welcome Sophie Green from ABHI. And Sophie, just to set the scene, I think your presence is very pertinent. I'd love you just to give us a sense of what you do at ABHI, and this whole area around US accelerators and how important localism is in any plans for the US. Can you give me just a combination of your sense of both of those things, Lucy?
Yeah. No, thank you. And expert is very kind, so I'll take that. I'm Sophie Green, International Accelerator Manager at ABHI, and my role is predominantly managing and coordinating our US Accelerator program, which is an established program that's actually been running since 2018, supporting around 110 companies actually navigate, land and scale in the US. I'm delighted to actually have Foothold join our program this year as a supporting partner to support our companies throughout their time on the program. But firstly, before I kind of get into answering your questions, I just wanted to intro ABHI a bit more broadly, as I'm aware some people on the call might be completely unaware of who we are and who we actually are as an organisation. So ABHI, Association of British Health Tech Industries. So we are the UK's leading industry association for health tech, and this covers medical device, diagnostic and digital health technologies. We are a membership organisation, 100% funded by industry to support industry, and our members range from multinationals to small and medium-sized enterprises. But myself, along with 6 others, we purely focus on international and supporting companies export into new markets, and we do this through various activities, our US Accelerator program being one. We also have one in the Middle East, and a whole host of other global exhibitions that we are the key UK agent for. So I just wanted to give a bit of background of who we are and what we do more broadly. But yeah, bringing it back to the US, it's obviously a super attractive market, biggest in the world, lots of spending power, and you know, it is less fragmented, but still super complex to navigate, as I'm sure you all know. But equally, the right inroads and key people to speak with is sometimes like finding a needle in a haystack, so to speak. So sometimes one of the biggest hurdles is deciding, right, where shall we go first? And we thought the exact same when actually establishing the program back in 2018. And we initially identified Texas as that kind of destination to go to first, and we launched the program in collaboration with the Dell Medical School, part of the University of Texas, so companies could really work closely with their faculty, test and validate and trial their products. And the thinking behind going to Texas was because of that massive clinical infrastructure, fast growing life science clusters, and also diverse populations as well there. But equally, you know, Texas might not be the right spot for all companies, and it shouldn't be. So we also noticed that, okay, we need to expand this, and we've expanded the program to be somewhat of a nationwide program, statewide program, having kind of numerous networks in different states now. As we identified, that was really one of the key hurdles that companies had when going to market, and we see the real importance of building up those networks of health systems, group purchasing organisations, insurance companies, but also that wider ecosystem that's down on the ground to support companies land successfully in market. It's super important to understand the nuances in each state, and that's hopefully something that we support companies do when they're establishing their strategy ultimately to go to the US.
And Sophie, there's obviously some really interesting cities apart from Boston and Los Angeles where you can do this. And I love Boston, don't get me wrong, but it can be super expensive. And places like Arizona, Minnesota, North Carolina, as well as Texas, Florida, lots of other cities have got a really dynamic and engaged accelerator programs that could
Yeah.
be, scouted for.
Yeah, no, 100%. And actually, up until this year, we haven't looked at Boston and New York, and that's not to look down on Boston and New York. They're amazing for a reason, right? And we are going there on our program actually this year. But we for example went to Phoenix last year. What an amazing ecosystem there is there, and I had no idea about it as a as a city really before actually being there and seeing how joint up it is. And you've obviously got Mayo Clinic and the ASU accelerator, which has supported actually a couple of UK based companies as well, and they're there today. We met with actually a company, my
MyCare,
care
or
my care
they're My Health now.
my health.
They had to change
Yes.
the brand slightly in the US, but Kelvin at My Health.
Yes, that's who we met with.
And there's also
Yeah.
another one there called Memory Lane Games,
Yes.
which is another GB company who's done well in Phoenix.
Yeah.
But Sophie, that's great, and obviously loved you just to come on at the beginning, and hopefully, as mentioned, this first online event is something we're going to hopefully do a deeper dive online bootcamp later in the summer. And hopefully we can invite you back to talk in more detail. But thank you so much for kicking off and giving context about the importance of US cities, not just looking at the noise from federal government.
Yes, 100%. No, thank you for having me.
Fantastic. Thank you so much, Sophie. If I may now, I'd like to really now get down to the other experts we have on the call. And if I can just ask each of them to come to camera for a minute or so and just give us an overview of your sagacity and talent and road mapping. If I may, I'd love to start with Thierry, who's based in Lausanne on the shores of Lake Geneva. Thierry, tell us about what you and Invictus does.
At Vivactis, you mean?
Vivactis, I'm sorry, Vivactis. I'm sorry. Why do you call it Invictus? Yes.
I don't know. Okay, so hi everyone. Yeah, my name is Thierry Weber. I'm a physician by background and ended up in the industry and also in the agency world. I'm for Vivactis. I'm the medical director of Vivactis Europe. And I work mainly on the marketing aspects of product launches in the life science sector. Well, this is mainly what we do at Vivactis Europe.
Thierry, thank you very much indeed. And if I can, obviously you're going to do a presentation in a few minutes. Looking forward to that very much. If I can now introduce you to our second panelist, and that's Chris Driscoll from Mishcon de Reya. Chris, tell us something about your regulatory and compliance expertise.
Thank you, Mark. Nice to meet you, everyone. So as background, I'm a US corporate partner within Mishcon de Reya's emerging company group. Despite the accent, I'm, as I said, a US lawyer. I spent much of my career practicing in New York and Silicon Valley before coming back to the UK several years ago. And since then, it's increasingly advising non-US companies on their US expansion and what is completely a different regulatory and compliance regime. So thanks for having us today.
Chris, it's a great pleasure. And if I can move on to someone I've known for many years and who is a director at Foothold America, and that's Laurie Spicer. Laurie, tell us something about your expertise.
Sure. Thank you, Mark. And thank you for organizing the event. Before I start, I also just wanted to give a quick shout out to my team members who are also on the call. I've got Jack Peters. I don't know if he can come to camera just to wave and say hello. I don't know if he's there. Jack is our senior U.S. expansion advisor who is responsible for helping European companies expand into the U.S. And I've got also Amelia, and I don't know if Nat can come to camera, but they are also working behind the scenes to help this this webinar take place. So just wanted to introduce myself. My name is Laurie Spicer. I am a director here at Foothold America, and I am an American living in the UK. I've been here now for about 33 years. I started off my career in the IT industry, and that's how I ended up here in the UK, and more recently, I ran my own business, but since then I worked as a US specialist for the UK government for about 8 years, and I've been with Foothold America for about 4. My role at Foothold America is really to help companies understand the complexities around employing staff in the US. And the US employment landscape is pretty complex, and it really is probably one of the things that causes huge headaches for a lot of the HR teams in the UK and the EU. And so we're here to kind of help with HR regulations and keeping companies compliant. And we've been doing that exclusively for about 10 years now. And we have teams here in the UK. We also have Jack, who sits in Munich, and our HR team that's based in and around Tampa. So yeah, we're very excited to provide more information for you guys today. So nice to meet you. Thank you.
Laurie, thank you so much. And finally, if I can, and as always, delighted to introduce him, is Michael Holland from Blick Rothenberg. Michael, tell us about your accounting skills in terms of the US.
Thank you so much, Mark. Thanks for having me. It's a pleasure to be here. I am a US qualified tax advisor, so US and UK qualified, and I sit in Blick Rothenberg's London office, facilitating and helping non-US businesses with the tax and accounting side of expanding into the US. There are many misnomers, misunderstandings. Everybody's afraid of the IRS. So actually having those conversations and helping people understand what they're getting themselves into and how to navigate the US tax system is where me and my team really help out our clients. We really specialize in tax treaties, so treaties that the US have with the UK, but also with other European countries, to help ensure that your local taxes synchronize nicely with the US tax system too.
Michael, thank you so very much indeed. Now let's get back to Thierry at Vivactis. And Thierry, you've prepared some slides to look at the sort of market research and market development. Love you to come to camera and explain a little bit more. Thierry, you there? Oh, you're on mute, Thierry.
Yep.
There we go.
Okay, sorry about that. I was asking you in mute format whether you could see my screen, so I'm not sure if you could. So let me share my screen again. Can you see it?
It's hopefully, yes, it's all there, Thierry, in all its splendor.
Okay, cool. So I'll move on very quickly, and for the sake of time, obviously I won't go into too much into detail at this stage, but the idea is really to have a second webinar later in the year, as you said, Mark. But this is just to give you an overview, particularly for the ones of you who are less familiar with the life science sector. It's to give you an overview of a typical market product launch on the European market or also on other markets in the world. The key message of this chart here, and once again, it's from a marketing standpoint only, what you're seeing on the screen. And so I'm not talking about regulatory aspects or clinical aspects, but the key message of this chart is that you need to get prepared very early in the pre-launch process. So you need to get, if you see the chart and you see my arrow, as you see here, the time frame to prepare a product launch in the life science sector is really 2 years minimum. And this is what, very large pharma or medtech companies are very good at. They have the staff to prepare these launches. And of course, for smaller companies, particularly startups, it's much more difficult for them to have the resources to prepare a launch effectively. So without, once again, going too much into detail, what you see here is that you have, once again, from a marketing standpoint, act on various aspects. For instance, the brand promotion or the market development. You have to start to prepare your market by engaging with key opinion leaders very early in the process, as you see, at least a year before, as you see here on the chart, at least a year before the launch. This raises questions of off-label discussions, etc., etc. But lots of things to do wherever you are in the market, and specifically when it comes to the life science sector. So there aren't much differences when you look at the details of the process of the pre-launch phase. There aren't much differences between Europe and the US. In order to see those differences, you have to go a little bit deeper into the analysis. So as an overview, once again, this will be covered much more in detail by other colleagues from the Vectis group who have more experience than I have in those US go-to-market processes in the life science sector, always. But there are some differences, as you see here. So, for instance, the market structure obviously is different. In US, it's a single market. In Europe, it's fragmented. There is also differences in the evidence focus, like the US market is, spends more time in analyzing the clinical efficacy as compared with Europe, where it's more value-based oriented. The pricing also is market-driven in the US. It's much more controlled in Europe. The launch strategy is national in the US by definition, and country by country in Europe, which makes it obviously more complex in Europe, and very often takes more time than in the US. The adoption drivers also are different. In the US, it's more still driven by physicians. In Europe, it's driven by the regulatory bodies and the health authorities, also reimbursement bodies, etc., which vary from one country to another. Once again, higher complexity in Europe. And finally, an area which is maybe more in my field as a physician and also as a medical director for Vectis Group is the clinical pathways. The clinical pathways are very, very different in Europe as they are in the US. So this, once again, we will go much deeper in those analyses when we have the second webinar. Now, the key messages, I think, are the following. Once again, all this is very high level, and I know that I only have 10 minutes to go through all this, so I keep it very simple. Market analysis, data-driven in the US. Market analysis, very, very important in the US to also understand the patient pathway specificities. As I said before, there is a stakeholder focus, which is much more prominent in the US with, meaning by that you have to have a full understanding of the physicians' habits and the key opinion leaders also habits, how much they influence the prescribers, and also the role of the payers also as insurances. In the US is obviously very, very important. When it comes to marketing activities themselves, in the US you have really a commercial first model, so the success is really driven by very, very large sales forces, much larger than in Europe. Marketing also obviously is very important, and physician adoption of the products or the services are obviously key, probably even more important than in Europe. And also a very important aspect is that in the US you're allowed to do some direct-to-patient communication, which is not the case in most European markets. Okay, and then finally, Medcoms and medical affairs, as probably most of you know, marketing, I mean, medcoms is conducted by totally different teams, particularly in agencies in the US, than medical affairs. It has to be totally separated. So different teams manage those things, those different activities. And finally, the speed to scale is much faster in the US once you have launched your product on the market. So once again, very, very high level, and sorry for that at this stage, but hopefully we'll have the chance to organize a second seminar where I will bring on board some people who are much more experts than I am for these questions, and who will be able to explain the differences between the two approaches. And I'll also bring on board an expert from our partnering agency in the US, who will be able to give the market approach. Thank you.
Thierry, thank you so much. That's a great kickoff series of slides. And just to say, obviously, we do have a bit of time at the end for some Q&As. So if anyone has any texts or any questions, please do just put them in the chat. And later on, hopefully, we can find a response to them at the end of this session. If I can now bring into play our regulatory and compliance expert, Chris Driscoll from Mishcon de Reya. Chris, can you tell me what the main ways are you typically see UK biotech companies expanding into the US, you know, from a corporate and legal perspective?
Yeah, absolutely, Mark. So I would say it largely boils down to three main approaches. First, for some life science companies, they will explore partnership models with US counterparts, such as licensing, joint development, or other collaboration agreements. An advantage of that is it's sometimes a great way to dip your toe in the water or leverage a US partner's existing US infrastructure without the full operational overhead that goes with setting up operations in the US. Secondly, some life science companies will form a US entity as a subsidiary to their non-US topco. Typically, that involves establishing a Delaware C corporation, which is a fairly well-trodden path that can be done very cost effectively. The main advantage of that is you get a proper legal presence, and it removes some of the friction of some of the operational aspects when you don't have that US entity in play. And thirdly, some companies will explore what's known as a Delaware flip, in which a new Delaware corporation is placed above the existing non-US entity as a new holding company. And that reorganization can improve a company's ability to access US capital markets and potentially raise at higher valuations. However, unlike setting up a US subsidiary, it's generally not as straightforward of a transaction, and it's usually only done at the request of a US investor and in conjunction with a financing round. Ultimately, the approach it depends on your particular company, what you want from US expansion, and your own timeline as well.
So timing wise, when would a life science biotech company really need to create a separate US entity? And secondly, if I can ask, why are so many companies incorporating in Delaware?
So again, it does depend on the company, but some of the key factors when our clients will be looking to set up a US entity, often as a subsidiary, will be firstly, when they're hiring US-based employees, then it generally makes sense to do that through a US entity. Although there are alternative arrangements such as employer of record services, which Laurie can obviously speak to, but that will be oftentimes a key moment, an inflection point in that decision. Immigration considerations. So if you're looking to move personnel to the US who are not US citizens or green card holders, then it's often required to have a US entity in your structure to sponsor them. US clinical trials, given this is a life science audience, if you plan to undertake US-based clinical trials, then it's often significantly cleaner and faster to have a US entity with interact with US CROs and trial sites and institutional review boards. So those are some of the key tipping points that we see in terms of setting up that US entity. And in terms of why Delaware, it's a very strange thing that you have this small eastern seaboard state that is home to 1.5 million corporations. The reason for that is Delaware has a very well-developed, flexible corporate statutory law. It has a specialized court system that's comprised of expert judges who are dealing exclusively with corporate disputes that gives predictability. And also you have an efficient Secretary of State, which is the equivalent of Companies House in the UK. And that means whenever we want to set up a Delaware entity or we're working on a financing, we can often make those filings within an hour, whereas certain other states will take days to do that. So it's an assortment of reasons, and a big part of that is it's just become the de rigueur market practice.
And I know, Chris, you're not an FDA specialist, and we, as I mentioned on the future deep dive bootcamp, we will bring in some FDA specialists who we know very well. But in terms of the regular considerations around what you should do compared in the US compared to the UK, what additional advice would you give UK life science biotech companies around that?
Yeah, thanks, Mark. This is really an area which separates life sciences from other sectors expanding to the US. For life science companies, it's the regulatory considerations are often a central organizing principle for the entire expansion strategy. While, as you say, I'm not a regulatory lawyer, I know my colleagues will often flag a few practical tips. The first of which is to engage with the FDA early and often. It's the interaction with the FDA is generally an ongoing process and it's not a one-time filing. And the second thing I would say, certainly worthwhile exploring pre-submission meetings and potential expedited pathways. So those pre-submission meetings, as an example, can be a great way to get the FDA steer on study design, on endpoints and other data requirements before you commit significant resource. And in terms of the expedited pathways, they can obviously fundamentally change your development timeline and commercial story as well. And the only other thing I would flag, definitely worthwhile considering US-based clinical trials, beyond just the potential regulatory requirements of conducting clinical trials in the US. It often also carries strategic weight, particularly if you're looking to raise from US investors or have US-based commercial partners as well.
And Chris, I know you're not an IP lawyer, but have you got any tips about how IP should relate to companies looking to expand in the US? Because it is quite a pivot point, isn't it?
It is. No, we whenever our companies are looking to move out to the US, we always loop in IP at quite an early stage. The first thing I'd say, it's important to know the patent risk before you commit, including any potential threats from competitors with their existing portfolios or patent trolls. You don't necessarily always need a full patent search. Indeed, in some circumstances, it's not advisable, but it's important to have a good working understanding of the landscape. The second tip I would say is to lock down your own IP ownership and any trade secrets via proper agreements. So you want to ensure that NDAs are in place before you have any sensitive discussions or disclosures to US partners or consultants. And to the extent you're involving US-based contractors, much the same way as in the UK, but to ensure that those contracting agreements involve IP assignment clauses so that any IP vests in the company, because it doesn't always automatically belong to the company in the US unless you have those explicit provisions there. And then finally, make sure you involve a trademark lawyer early. The US has a test, which is a trademark register, which is a great place to start. But there are also certain rights that can be ascribed when parties are just using a trademark without formally registering. So always good to make sure you have that trademark protection in place as well.
Fantastic, Chris. I've got a question in here from Mark Swanson in Minneapolis, and he's saying some of the US funding mechanisms require presence in their home state. How would you handle that?
Yeah, no, it's true. I mean, certainly there's a number of grants like SBIR grants and SCTP grants and other grants where it can require that that presence. So it really is a fact that needs to be factored into your US expansion strategy in terms of where you choose. Is it going to be a traditional life science sector like Boston or San Diego, or is it a competitor market, maybe North Carolina, which they increasingly, if you have presence there, that can result in additional funding. So something to definitely factor into the consideration of where you choose to set up.
Fantastic, Chris. Thanks for that, and we'll come back to you at the end with the Q&A. And if I can now just introduce you to my colleague and director at Foothold, Laurie Spicer. Laurie, obviously, how you hire, when you hire, and how you do it is pivotal to your DNA. Tell us more about flexible hiring on the ground in the US.
Sure. Thanks, Mark. Yeah, so I think as Chris alluded to, there's a few different routes to market when you're starting out your US expansion journey, but oftentimes we tend to get introduced into the conversation when companies are thinking of hiring, and there are a few different options. Generally, when companies are thinking of hiring, the hires that we see quite often, it's based either on they need FDA sort of input or interaction, or they might want clinical trials, as Chris was saying, or they're looking at commercial sort of expansion and they want to hire some business development. So once that decision is made, the US is pretty competitive and it's fast moving, and it's probably more complex than a lot of people think. So one of the offerings that we have that works really well when they need speed and they need to get on the ground quickly to hire a US person, a US sort of a person in the US that has the right to work, is our employer of record. And our employer of record is where Foothold America becomes the official employer of that person, and that person would jump onto our benefits, our insurances. We would be responsible for making sure that the relevant employer taxes are paid to the relevant state and federal agencies. But the company in the UK or in the EU would be managing that employee, and as far as the rest of the world is concerned, they work for that company. It's just we're in the background making sure that all the pieces are compliant.
Fantastic, Laurie. And so if you're going to build a team over there, how would you see that? What are the key considerations that you need to factor in?
Yeah, it's a great question. So employer of record is, I don't want to say generally a temporary solution, but it can often be a temporary solution where companies are maybe still testing the market, or they're thinking, okay, yes, we do want to set up an entity, but setting up an entity and putting all those pieces in place can often take a long time. So if they're building a team, let's say they start with one, an employer of record is a great option. And then as they start building their team, then generally what we introduce is our co-employment solution. And that's where, well, one of the good things about employer of record is that because we employ hundreds of people across the US, we can actually provide a really decent sort of packages as far for benefits in terms of health, medical, vision, and dental. And that's really important for US employees because they don't have a national healthcare system. So often a big part of the offering for an employee is surrounds the benefits and what benefits you can offer. So when the team starts building, what we can do, we have the co-employment model, which also will leverage those master healthcare plans and will allow some smaller groups, some smaller companies to benefit from a bigger master healthcare plan, which will then sort of result in lower cost with benefits. Because the one thing that is really important to know when you're scaling in the US is that salaries are a lot more expensive in the US. They're often tied to various different geographies. So if you're looking to employ in California, or you're looking to employ in New York, or any of the big major hubs, Boston, a big one for life science, the salaries are going to match that. So often going to second tier cities is often a way to strategize, still get good talent, but also have it be a little bit less expensive.
And that regionality, I mean, Sophie discussed that with me at the beginning, is so important, isn't it? Because it changes and your strategy needs to react to that regionalism, doesn't it, Laurie?
Yeah, 100%. And I think, salaries in the US, they're not just a little bit more expensive. And of course, it depends on the roles that you're looking for, but they could be 30, 40, 50% higher than the same roles here in the UK or in the EU. So it's important to still be able to understand that although a lot of companies do focus, a lot of life science companies focus on Boston as kind of the place they need to be, and some companies do need to be in Boston, but there are so many other options. There is Philadelphia, there's San Diego, there's the Research Triangle in North Carolina, there's Minneapolis, there's many other options that are certainly worth investigating. And again, there are major universities in all those places that are pushing out really fantastic and qualified talent. And there's also ecosystems there too. There's a lot of accelerators in various places that, again, worth doing the research and also tapping into the economic development boards for sure.
And one of the fundamental differences between Europe and the UK and the US is this employment at will, isn't it, Laurie? That's a really important consideration across the pond.
It is. And it's something that a lot of times will scare our EU and UK companies. They're like, well, wait a minute, what do you mean they can leave whenever they want? But it is employment at will, and we as an employer of record, we make sure we comply with those at will regulations. And so generally the standard we see most is that people and companies alike will give a 2-week notice, although that's not a legal requirement. It's mainly more a courtesy. And so I guess, what you'll find in the US is I think you'll find workers who work hard. I don't know if it's because of they're only as good as their last deal, or they feel like they need to work hard every day because, there's no long-term contract that they're resting on.
Laurie, thank you so much. We'll come back, if I may, at the end with some further questions, but it's a great overview from a boots on the ground talent perspective. And if I can now introduce our last panelist, and around, of course, the thorny area of tax. Michael, what are the key tax issues that a life science company needs to consider when setting up first in the US?
Thanks, Mark. It's a really good question. Life science businesses, when they expand into the US, really wholeheartedly both feet into the system. They dive right in because of that connection with lots of different regulatory bodies, with local authorities, with grants that might come from different government agencies, meaning that they don't dip a toe in the water when they first start. They really wholeheartedly get right into the middle of the tax system, which means that for many businesses, they might begin with a federal issue and then a state and then a local and then another state. Usually, life sciences businesses are straight into the middle of federal filings, state filings, local filings, and usually multiple states because they will have employees or studies happening across different state jurisdictions. So when it comes to life science businesses, it really goes from 0 to 100 really quickly in terms of US operations. The key tax consideration really comes down to IP. So as Chris touched on, the value is in the IP. It's potentially high growth. The IRS are particularly interested in how that IP is being developed and grown and how the structure works together. There is the opportunity for tax leakage if IP is not being looked after correctly. There's all sorts of different things that could go on that really bring a life sciences business right into the heart of tax issues very, very quickly. So it's a steep learning curve.
So there's a negativity, obviously not negative, but tax is obviously something to really address as soon as possible. But there are some incentives, aren't there? Some benefits around US R&D plays. Can you expand a little bit on those, Michael?
Yeah, absolutely. So most tax systems have R&D credits or R&D incentives because governments want businesses to bring their research to those shores and to their workforce. And the US is no different. However, in a very typical American way, the incentives are all weighted very heavily towards R&D that takes place in the US and actually is there's very little that you get in relation to R&D that takes place outside of the US. So there's a real encouragement for businesses that are undertaking research and development to do so in the US using US workforce, US resources, and US suppliers. The incentives can be particularly beneficial to businesses that are just getting started up because they can create credits that offset income tax, which isn't normally an issue immediately, but maybe in years 3, 4, 5 can be a really relevant consideration. But more importantly, they can create credits that offset payroll taxes, which actually from day one can be a real liability for the business.
And in terms of following the money, how can or should life science companies think about transfer pricing, especially if when they're outside of the US?
So it's a really good question, and actually it's probably the key consideration here for any transatlantic business. Now, in most other businesses, it's a consideration, but it's not ultimately the top priority. However, in life sciences businesses, the IP has so much potential for value that every taxing jurisdiction is going to be really interested in where that IP accumulates and ultimately where it can be taxed. So when it comes to IP and transfer pricing, really it's all about looking at where the IP sits, where that is created, where that is being generated, and how that IP is being used. And so transfer pricing comes in to match up the location of that asset with the profits that accumulate within the group. Transfer pricing is often something that people will draft into an agreement and put in a drawer and never think about again. And actually, for life science businesses, it's even more important because the risks of being challenged by tax authorities or potential investors at some point in the future are much higher. So having a diligent, well thought out, realistic transfer pricing agreement in place that's reviewed often becomes really important.
We've talked from the other presenters about the locality and regionality of the US, and that has a huge impact in terms of tax, doesn't it, as well, Michael?
Yeah, absolutely. So everybody thinks of the US as one country, which obviously it is. But from a tax perspective, you should really think of the US as a collection of 50 different taxing authorities, and actually in some cases even more. Each state has its own tax rules, it has its own tax rates, it has its own tax policies. And actually, it's very easy for a business to create nexus, a taxable connection in a state, and become subject to those rules. So even things as simple as hiring an employee that's based in a state, conducting a trial there, storing your samples, even having a traveling salesperson move between those states, but habitually spend time in one location is enough to trigger nexus, which means one business can suddenly become exposed to 3 or 4 different state tax filing obligations. And it's really important to think about that as early as possible because you don't want to be playing catch up. You don't want the state to come to you and be following up with you. And if you have employees, it's likely the business is already on that state's radar because they're already collecting the employment taxes and things like that.
Michael, that's a great overview from a tax perspective. Thank you. We've got about 10 minutes left, and what I want to do is bring back the other experts in. And the last question I asked Michael, I'd like to ask each of you, and that would be: are there any common pitfalls that you've seen with the life science companies you worked for that you would help them avoid when they look to expand in the US? And maybe Thierry, if I can start with you on that, have you got some thoughts about avoiding pitfalls that you can share with us?
Yeah, so for companies, I think once again, from a marketing perspective only, so I'm not covering any regulatory aspects or any clinical aspect, but from from a marketing standpoint, I think one of the main area where you have to be cautious coming from Europe and going to the US is this difference between medical marketing and medical affairs. So you really have to consider those two areas very, very distinctly, and not try to do the two at the same time as you would do in Europe, in most countries in Europe at least. I think from a marketing perspective only, that's the main area where you have to be cautious. And also, once again, but this is valid for any kind of go-to-market in go-to-markets in life sciences, you have to anticipate things very early. So start your market launch preparation once again, at least 2 years before the launch itself, and not wait at the last minute, and not, focus too much on the FDA and taxes, things like that, but and forget the marketing part.
It's very important, and great to hear that view from an expert marketeer such as yourselves, Thierry. Thank you. And if I can ask the same question of Chris, common pitfalls from a compliance and legal perspective, Chris, what would you advise?
Yeah, we touched upon it a little bit earlier, but I would definitely recommend choosing Delaware whenever you're setting up an entity. We occasionally come across some companies that have set up in another state, particularly if that's your top co. It can present real challenges when you come to do financing rounds. If you choose, let's say, an outlier state, it can hold up process. In Delaware, whenever we need to make filings, we can do that often, within an hour. Other states can take up to 2 weeks. The other thing, when it comes to choosing entities, again, this can depend on whether it's going to be a topco or if it's a subsidiary. There's different types of entities in the US, from C Corps, S Corps, limited liability companies, and limited partnerships. Generally speaking, in probably 90% plus of cases, it's a C Corp is most appropriate, but obviously speak to a tax advisor or lawyers before you do that. Those are probably the two main ones. Particularly, the only other thing I'd mention, obviously on the regulatory side, just being so important before you land in the US, it's really important to partner with a good regulatory lawyer. At an early stage, you can kind of set out the roadmap for regulatory approvals and what that looks like in the US as well.
And Laurie, I know you've seen good and bad examples over the years, but can you both highlight, without naming names, a challenging situation and a positive situation in terms of US expansion that you've seen recently?
Sure. So probably a very challenging situation is when I came across a company that had hired somebody in the US under their UK company, which is a very risky situation and not one that's recommended. So we were able to get that employee onto our employer of record within a week, just to keep them compliant. Employment lawsuits are a real thing in the US, not that they are very common, but they can be very expensive. So it's just making sure that when you go into the US, that you have that mindset of keeping safe. And if you work with, obviously, Michael and Chris on the legal and tax side, but on the employment side, employment law is also state specific. So you will do one thing for an employee in California, and you will need to do something else for an employee in New York. So it's important to understand that those compliance pieces. So that's something that we can help companies make sure that they can sleep at night in terms of employment. But also, I would say one of the other things that I've seen, which has been a real shock factor for some of our clients, that they don't fully understand the true cost of employment in the US. And it's not only that the salaries are higher, but generally there are things that are not mandatory, things like a 401k, which is a pension, a retirement savings. It's not a requirement like it is here in the UK, but if you're not offering it, you're not going to be competitive. And because the employment market moves so quickly, you really do want to have a 401k offering. You want to have decent benefits, and not all benefits are created equal. So if you're looking to hire life sciences, and our background, our founder was a biotech consultant who moved to Boston many years ago and sort of really understood the market in terms of how, what is a competitive offer. And that's, I think, really important, that you offer decent benefits, which of course we can help you with. And yeah, just making sure that all the boxes are ticked.
And in your experience, Laurie, you obviously, is there a recent example of a company that's done this really well, without naming names,
Yeah. Yeah, I think, in terms of what I've seen, sometimes we start talking to companies that are 2 to 3 years away from their US launch. And it really is about doing the research, understanding the pieces, and I think as Chris or Michael said that, or I think it was Michael, that, there is much more involved when it comes to a life science companies going into the US because of the regulatory nature of what needs to happen there before they actually get boots on the ground. So we tend to be one of the providers that come in, right when there is a hire that's ready to be made, or when they need to start recruiting. And I think a really good example is when a company can see the value of hiring a US local expert that maybe has the network and has the connectivity in that ecosystem, and also takes one of their senior leaders and sends your senior leader over to the US to sort of make sure that the company culture is transferred, the HQ, there's alignment with the HQ. And that's really important, is when you have a smaller office or a sales office in the US, is to really have that connection with the HQ in the UK and Europe. It's super important to keep those communication lines open.
Because again, just going back to Thierry and Michael and Chris on this, that whole idea that obviously you have founders who come up with a great idea, a great piece of technology, whatever it may be, and they've developed the product, but when they come over to the US, are they the right people to then provide the evangelism? Because there's a split between that technical expertise and knowing what to know to build out there. And if I can just ask the three of you just quickly, what's your experience or your sense of that? And Thierry, could I start with you?
Sure. From a marketing perspective and sales perspective, we work with our local partners in the US. We would never dream of doing that by ourselves. I mean, of launching a product on the US market just by ourselves. However, our customers do have the knowledge of the product, do have the knowledge of the European customers, but then we need to coach them, and local experts need to coach them so that they adapt their messaging to the US specificities.
And if I can ask, obviously, just finally, Chris and Michael, that whole founder play, both in terms of investment and corporate structure and engagement in the US, what have you seen recently juxtaposed there?
Yeah, I would just add, from, given that we work with a huge amount of companies that are looking to raise from US VCs, then those US VCs will often look for someone on the ground, usually a C-suite executive, that they can work with regularly and add accretive value to the company. So Laurie touched on it, but as long as you have that individual's there, and it doesn't necessarily always need to be the founder, but someone at a relatively high level who can bring that culture and who can work regularly with that US VC or other investor, that can be a significant factor.
I think as well, Mark, we see when we speak to founders originally about going to the US, they're often reluctant, that they don't think they're going to move to the US. They're not keen on doing so. But actually, the US operations can snowball really quickly, and all of a sudden they can be drawn into the US. The US is also a place where people like to shake hands. They like to see people face to face. And so having those individuals on the ground in the US meeting key investors, key commercial contacts, just accelerates the whole growth in the US market.
And the final thing, just to wrap, is obviously there's difference in culture between how people work and react and engage in the US. And I'm very conscious of not being too verbose from a founder or a leader's perspective. And I know each of you probably got some experience of how that's worked. And I know you have, Laurie. You've told me on a number of occasions how that's worked for good and for bad.
Yeah, I think the culture piece is really important to understand, and we see it a lot with UK and EU companies hiring in the States, and they might not entirely understand how their employee operates and vice versa. So I think making sure that you've got a combination of both. I mean, I was an American that came over 33 years ago to set up a UK company, and wow, talk about culture shock. It's real. So it's just important to kind of understand that, and certainly in sales situations, if a UK EU salesperson is selling to a US audience, the dynamics might need to be looked at in terms of how you approach that situation, because I think we've seen there's a lot of disparity between a soft sell or a hard sell, and again, in the US is so big, you can't really I guess put the US entire country into one bucket, because you've got the East Coast, they operate slightly different. The southern states, they operate slightly different, and the West Coast, again, I've lived in all three places, and it does almost, and I'm from the Midwest, so it does feel like all those three places are foreign countries as well. So it's just about doing your research, taking cues and understanding, and speaking to experts to try and grease the wheels and ease the process.
And Thierry, I know you've obviously got a lot of people on the ground there, so that those cultural nuances, presumably, you know at first hand.
Yeah. Yes, absolutely. Yeah. But there are much less cultural variations in the US than there are in Europe, as you all know. So it makes things much easier, of course, once again from a marketing and sales standpoint.
Fantastic. Well, listen, can I just issue a huge thank you to our panelists. You've been exceptionally sagacious and interesting, and I really appreciate what you've said. As mentioned, as Thierry mentioned and I mentioned, we are looking to do a deeper dive online bootcamp, which we'll come back to you with more information on in the coming weeks. As again, a big thank you to all our panelists, and until the next time, thank you very much for watching. Bye for now.
You got a dream that's crossing oceans wide, a spark that's waiting on the other side. The map is big, but the goal is clear. Your future's calling from over here. Don't let red tape pull you down. We'll lift you up, get your feet on the ground. From setup to payroll, we'll take the strain. You focus on growth, we'll clear the way. Flood, make your move, we'll light your way. Foothold, America, we're here to stay. Build your dream in the USA. With trust, with care, we'll lead the way. From London to Tokyo, dreams all align. One team, one mission across every time zone. Hire your people, we'll make it flow. Compliance culture, we help you grow. No borders can stop what you've begun. Together we're stronger, the world is one. You dream it bold, we'll make it real. That foothold's yours, that's the deal. Make your move, we'll light your way. Foothold of America, we're here to stay. Expand your reach, start today. With trust, with care, we'll lead the way. Oh, hey. Oh, 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 home. benefits to banking, we make it whole. No need for worry, no need for fear. Your future's brighter, it starts right here. Make your move, take your stand. We'll guide your business hand in hand. Across the ocean, you found your plan. Foothold